Beaumont Hospital held a COVID update today to stress to the public that masks work and they should be worn indoors.
Dr. Frank McGeorge is here with the highlights on this. And Frank, with hospitalizations rising, they want that message to not just be heard, but heeded.
Yeah, absolutely, Kim and Jason. Especially with the start of the school year so close. As school boards consider the mask recommendations from the CDC and the Michigan Department of Health, another major healthcare system is weighing in on the value of masking, in particular to decrease the spread of the Delta variant in schools.
The idea that we have this entire population of people who cannot be protected by the vaccine, and they're going to make masking optional in a place where they can't keep social distancing as well. And kids, as you know, are much more likely to hug and touch, and get together in a much closer range. It's just not safe.
Dr. Matthew Sims is an infectious disease specialist at Beaumont Health.
The fact of the matter is, it just takes one or two cases to start ripping through schools. It's just a danger that there's no reason to take the risk of, making this optional.
He added there's even more reason given the prevalence of the Delta variant.
If both people are masked, you've put a barrier in place, and that barrier is in place whether it's wild type or alpha or delta.
Pediatrician Dr. Sandy Patel noted the trend in the number of pediatric cases.
If there's more COVID in the community, there's going to be more pediatric patients affected. In the last few weeks, we definitely have started to slowly inch upwards a little bit. I think it's sort of a multifactorial answer that the mitigation strategies are different. Not a lot of the pediatric patients may have natural antibodies, and of course they all can't get vaccinated if they're under 12.
Now, both doctors also emphasize the importance of getting all eligible people vaccinated as soon as possible. Now, remember, you are not considered fully vaccinated until 2 weeks after your second dose, which in the case of the Pfizer vaccine is 5 weeks from your first dose. And that means for kids returning to school, the ideal starting time has actually already passed.
Frank, how concerned are local doctors as we see what's happening in the southern states right now?
Well, Jason, there's a lot of concern. The more contagious Delta variant, kids heading back to school, and areas in Michigan where there are still a lot of unvaccinated people is frankly a combination that's going to lead to more cases. The real question is just how many more and what are people willing to do to help stop the spread?
Yeah, and we're getting into that, seems like on a daily basis. All right, Doc, thanks.